ice and heat. Okay, now you may have gotten lots of differing advice from different people about ice and heat. Okay, when it comes to this particular surgery, please pay attention to what I'm about to mention to you now. Okay, it's going to be different most likely than what you've heard from other doctors and from your physical therapist and anybody else as it pertains to ice and heat. And I'm going to go over why we choose to do things a little bit differently. Okay, so for the first 48 hours after surgery, you can use ice. Okay, and a lot of people find that it's helpful in terms of managing discomfort. So use the ice. Don't use it for more than 20 minutes every hour. Okay, but you can use it every hour, but not more than 20 minutes every hour. If you do it more often than that, you do run the risk of developing frostbite. Okay, and so pay particular attention to that. 20 minutes at the most every hour. Okay, that's for the first 48 hours. After 48 hours, do not apply ice any longer. Okay, you can use heat again for up to 20 minutes every hour. And the reason for that is that the ice is helpful initially after surgery because it decreases swelling by decreasing blood flow to that area. Okay, and it also helps with pain for some patients because it numbs up the nerves, kind of like just before frostbite, and that's the reason we don't want to overdo it, because you don't want to end up with frostbite. But the reason we switch to heat after 48 hours, which might be contrary to some of the things you've heard from other people, is that the heat causes the blood vessels to open up, okay, what we call vasodilation. And when the blood vessels open up, it increases blood flow to that area. It increases oxygenation. It increases the amount of nutrients that get to that area. And as a plastic surgeon, one of my highest priorities is making sure that that wound heals as well as possible and as quickly as possible. And the heat and the nutrition and the oxygenation and the improved blood flow ensure that that wound is going to heal as well as possible. Okay, by using ice, what you're doing is you're decreasing blood flow to the area. You're slowing down the healing process. Okay, now I'm not telling you to not follow your other doctor's directions if you've gotten instructions about some other kind of surgery and what they're telling you as far as ice goes. Okay, whatever your other doctor told you about your other surgery, follow those instructions. But when it comes to a surgery that I have done for you, please follow these instructions. Ice for 48 hours, again, no more than 20 minutes every hour. And then after the first 48 hours, switch to heat. Do not apply ice any longer after the first 48 hours. Okay? Lastly, if you have any concerns or questions that were not covered in this video, or that weren't covered in the written discharge instructions, or there's something that you're confused about and you don't understand, that's a good opportunity for you to call our office or email us, or to send me a text message or call me. Again, you have my cell phone number. Every single one of my post-operative patients gets my cell phone number, so this is the time when you want to text or call if everything we've just gone over is still confusing or doesn't answer a question that you have. Okay, so don't be shy. Let me know if you have any other concerns or questions. And most importantly, please be careful and take care. We look forward to seeing you soon.